Vaccine injuries are now out in the open. Can you believe it? We're about to get to this thing called common knowledge. Hi, everybody. Chris Martinson of Peak Prosperity here. Common knowledge is when everybody knows that everybody knows something. You and I can know something together. In fact, everybody listening to this can know something, but it's private knowledge until somebody yells it out and performs that role of the child in The Emperor Has No Clothes, when the child shouts out, hey, he's naked, and then everybody knows that everybody knows the same thing. Then it becomes what's called common knowledge. So the common knowledge game is afoot, and I've always said that things change very rapidly once you get to common knowledge. So we're tracking that common knowledge game at Peak Prosperity all the time. It's really important. These vaccine injuries are now out in the open, and it's not just the internet saying that anymore. For those who need their stuff coming from a central approved source, this would be the source we're going to discuss today, which is this New York Times article saying thousands believe COVID vaccines harm them. Is anyone listening? Oh, what an interesting framing on this. I'm going to tear this article apart because thousands, how about millions? Not believe, but we've got all the proof anybody could ever want. Hello, everyone. I am Chris Martinson of Peak Prosperity, and my question for you is making sense of the global scene a challenge for you? Are you too busy, maybe, to keep up with all the updates? Well, I have some good news. I offer 120 scouting reports every year to my subscribers, just like the one in this very clip. Save time, stay sharp, all for less than $1 a day. So look, this was a front page article by Apurva Mandavili. I have not ever really forgiven her for such all-star classics as this. Remember Apurva back in the day saying someday we will stop talking about the lab leak theory and maybe even admit its racist roots, but alas, that day is not yet here. Yeah, Apurva, that's what it was. Racist to believe that the PRRA, Fear and Cleavage site, and the restriction sites sprinkled along in a no-see-em sort of a pathway, highly suggestive of racism. Or it could be lab creation. Of course, that's what we always knew it was. So at any rate, Apurva's been absolutely running interference for the machine, for the COVID machine, for the pharma companies the whole way through, and really no different here. This is from a May 3rd article. She writes here, within minutes of getting the J&J COVID-19 vaccine, Michelle Zimmerman felt pain racing from her left arm up to her ear, down her fingertips. Goes on to recount this poor woman's experience with that. It's terrible. But why the J&J? Now, J&J is one that, of course, isn't one of the mRNA vaccines, and I'm not even sure that the J&J was supposed to get approved. Somehow, this was an adenovirus vector vaccine, and this is something that, of course, they're going to do everything they can to frame the vaccine injuries around the J&J vaccine, when in fact, most of the case reports that are sitting out there right now pertain to the most commonly delivered mRNA vaccines, as the Moderna and the Pfizer vaccine. So, of course, you would count on Apurva to start out with a J&J anecdote, knowing most people aren't going to get much past the top 5 or 6 paragraphs or something like that. But look at that. It's right there in the first sentence. Within minutes of getting the 5 words in, J&J, right? There we're there. So that is part of the fixing. This is a fixer article. This is a Trickle-truth. This is starting to leak out the idea that, maybe there are such things as vaccine injuries, but let's pin it on the J&J vaccine, which, by the way, kind of interesting that it's in the same adenovirus vector vaccine class is the AstraZeneca vaccine. Christine Anderson, the MP there out of the EU, writing quietly and secretly, the EU stops approval for AstraZeneca's COVID vaccine. But, of course, the billions have already been earned. The scam has driven through the streets, and Big Pharma is finally satiated. So today they revoked approval of Vaxzevria 5 weeks ago. And so there it is. Commission implementing decision, withdrawing the marketing authorization granted by decision, this one here, for Vaxzevria. So that's gone. So now we're seeing that, okay, there's a hit out on these 2 adenovirus vaccines, but why just them? Well, let's carry on. Let's go back to this article really quickly. So as we go down into this, we come on down. Dr. Zimmerman's, harrowing thing. Her life really got upended, like everybody who's been truly vaccine injured, regardless of which type of vaccine. It's pretty bad. And so then you see the first part of just damage control here, which is, well, here we've got a quote from Jeff Nesbitt, a spokesman for the Department of HHS, in an emailed statement said, hundreds of millions of people in the United States have safely received COVID vaccines under the most intense safety monitoring in U.S. history. Okay, that right there is a whole bunch of propaganda. That's a lot of propaganda because, first off, we've had the least aggressive safety monitoring ever in history. We have this thing called the VAERS system, which everybody tells you, and you'll even see it later in this article. They'll tell you flat out the VAERS system is really not fit for purpose. It's a terrible system. Like anybody can just log anything in and nobody really follows up, so we don't really know what it says. Well, then why do we have such a stupid system then? Why don't we have somebody following up? Why don't we make it a robust system? Why, if that's a bad one, what's the better one that we're managing to put into place? Of course, they put in this other thing called vSafe, which allowed people to, hand enter stuff in on their phones. And unfortunately, that pre-selected just a small range of things that you could select as a side effect and didn't have the full length of things. Because if you looked at the complete side effect list of things that could have happened because of the vaccines, it's like 291 separate things. It's like a big old laundry list of ailments, many of them related to neurological conditions, immunological dysregulation, of course, being some of the worst, and the heart conditions, the myo and the pericarditis that we're familiar with at this point. So at any rate, that's an assertion, and it has two separate lies baked into it, right? First, that hundreds of millions of people have safely received the COVID vaccines, okay? It doesn't, whether or not that's true, it leaves aside the people who were injured, who did not get it safely, okay? Like if you said, if I gave this to the whole world and I said billions have gotten this vaccine safely, but 1 billion of them were deeply, deeply injured, that's still technically true, but it's kind of a lie by omission. So that's lie one. Lie two is the most intense safety monitoring in U.S. history, because I can tell you about case after case after case after case where people have submitted what they thought was a very solid, verifiable, temporally associated case of vaccine injury, and nobody followed up. Nobody called them. Nobody was interested in what happened. In fact, you'll hear that story over and over again. And then here too, we are in CYA mode by all these people who were up to their eyeballs and were responsible and not only dropped the ball, but absolutely blocked any efforts to try to get to the truth or to get any exposure on this idea that there is such a thing as a vaccine injury coming off of these poorly tested, quickly rushed through development vaccines that we've got. In this next line, look at this. But in a recent interview, to counter that, but in a recent interview, Dr. Janet Woodcock, a longtime leader of the FDA, who retired in February, just recently said she believed that some recipients had experienced uncommon but serious and life-changing reactions beyond those described by federal agencies. I feel bad for those people, said Dr. Woodcock, who became the FDA's acting commissioner in January 2021 as the vaccines were rolling out. I believe their suffering should be acknowledged, that they have real problems and they should be taken seriously. Really, Janet, you were in charge of the agency that could have done something about this. You had resources at your disposal, billions. You had thousands of people working there who you could have said, let's do this. Let's look at these things. Let's be serious about this. Let's gather the data. And you didn't do that. In fact, you blocked efforts to do that. And now we're supposed to imagine that a poor of Amanda Vili comes out and says, oh, well, let's just take a statement. What? Oh, Janet, you feel bad for those people? Oh, yeah, that makes you a humane individual. No, this is image repair, PR damage control 101, trickle-truthing, trying to get this out there and maintain something of a semblance of being able to go out in public and think, I'm still a good person. Sorry, Janet, you lost that. It's you don't get to think that about yourself anymore. You're not one of you should look at that old comedy routine. Janet, are we the baddies? Yeah, you are. By the way, this is fascinating. Let's go back up to the top. It says here, Apoorva Mandavili spent more than a year talking to dozens of experts in vaccine science, policymakers, and people who've said they've experienced serious side effects. More than a year. Gee, New York Times, thanks for the urgency on this one. People's lives are being injured and damaged, and these vaccines, these very vaccines, are being promoted and pushed on a vaccine schedule for infants down to 6 months of age, where nobody can actually articulate a cost benefit analysis, particularly in the Omicron era, where Omicron is, people widely recognize now, the most common effect of Omicron is a runny nose. And still, you would risk maybe blocking or limiting the length of that runny nose duration in a child against a serious and life-altering injury. That is not something that can ever be possibly, logically, rationally, or humanely recommended. It just can't be done. There is not a single case you can make that that at scale across a broad range of otherwise healthy children that we should be giving these things. But shouldn't also take a year to write this article. I think this article should take about a couple of weeks of talking to people. But if you had a year, you could also talk to people who understand the science behind what's actually happening. We have the IgG for class switching of antibodies, particularly on subsequent boosters, particularly on boosters 3 and 4. We have really serious safety signals showing up neurologically, immunologically, with respect to cancers, which is a subset, I believe, of the immunological dysregulation of all kinds of things going on for people that are quite bad. And you could have talked to some of those experts, but they did not. Janet Woodcock carried on. I'm disappointed in myself, she added. Janet, I wouldn't be disappointed in myself if I had done what you had done here. I would be considering seppuku at this stage. She added, I did a lot of things I feel very good about, but this is one of the few things I feel I just didn't bring it home. Okay, Janet. How many things do you think you had to do as the FDA, Food and Drug Administrator, where your prime job is to make sure that drugs that come out are safe and effective? You know, there's a lot of things I feel like I did really well. I feel like I redecorated my office really well. I ran really good meetings. I gave great performance reviews to everybody. I was very good at going out and giving talks to groups that weren't going to challenge me in any way. I feel really good about that. But one of the few things, injecting hundreds of millions of people with something that turned out not to really be all that safe. That was, just put that in the loss column, but mostly I got a lot of W's. Crazy how these people think, or that they think that this is just going to skip on by. But reading the comments in the New York Times, you will be surprised to find out that this really plays with the deluded audience that exists over at the New York Times. I am so sorry for all you New York Times readers who used to be thinking that this was a quality publication, a newspaper of record that was somehow did its best, even though it might make mistakes now and then, to carry the truth, to really explore something deeply, to have great editorial controls. All the people who are reading this now and feeling good about what they're reading in this really got some major mind-bending damage done to them because they're unable to connect dots and understand what really happened here. This was a classic mind F, big time, and it's really damaged a lot of people. But you know who got damaged the most? Those who are most highly educated or consider themselves intelligent. Of course, these are the people who would rail against the toothless MAGAs and all that other stuff because at least they're not ignorant like them. So they can't bring themselves psychologically to confront the idea that they were the ignorant ones. They got sold some snake oil in this story, and it's absolutely true. What happened? Okay, carrying on, going on to blame the fact that, you know, what we need more big government because we're really the fragmented healthcare system, the complicated detection. No, you know what it was? It was that nobody was interested in gathering the data. Step 1, don't gather the data. Step 2, claim no data exists for the thing other people are trying to claim. There were lots of people gathering data. They gathered it anecdotes, but of course, observational medicine is really important and it works really well. For observational medicine, you very simply observe that when you give somebody something within 24 hours, they suffer a serious complication, maybe death, that might be a connected event. And we had tons of evidence. We even had evidence in the clinical trials for the Pfizer shots directly that there were problems there in those first trials. The data was all there. All right. So the blah, blah, blah. blah, blah, blah. Nice picture of an arm there. So how about this? Patients who believe they experience serious side effects, reading in this article, quoting from it, say they have received little support or acknowledgement. True. Sean Barkovej, 54, a nurse practitioner in New York City who has worked on clinical trials for HIV and COVID, said that ever since his first shot, merely standing up sent his heart racing, a symptom suggestive of POTS, postural orthostatic tachycardia syndrome, which it is not suggestive of it. That's kind of the definition of POTS, when you stand up and your heart gets racing. A neurological disorder that some studies have linked to both COVID and much less often to vaccination. Yeah, you got the wrong studies in here, Apurva. I would think after a year you could have actually found out that those studies that linked it to COVID were from the earlier versions of COVID that no longer exist. They have not been circulating for years. If you look at more recent studies, you are far more likely to get POTS from a COVID update or booster than from currently circulating COVID. This is simple, deductive logic. This is the kind of stuff we used to be able to manage 5-10 years ago. This is what science used to be able to do. We used to be able to understand what the nuances were, and this isn't a nuance, right? We don't have no such thing as COVID. We had different variants. Delta was a very different beast from Alpha, which is a very different beast from any of the Omicron strains, right? Full stop. That's easy. This is easy. This is easy. But suddenly it's hard, you know? He also experienced stinging in his pain in his eyes, mouth, and genitals, which is abated, and tinnitus, which is not. And I can't get the government to help me, he says. Fruitless pleas to federal agencies and elected representatives. I'm told I'm not real. I'm told I'm rare. I'm told I'm a coincidence. This thing, they throw out rare. So notice so far, Apurva has managed to throw out uncommon, rare, much less often. None of these are actually scientific terms. Scientific terms have numbers, so at any rate, this is all propaganda. This is how propaganda works, working very hard to say, it was complicated. Good people did their best. Mostly they feel like they did a good job, dropped the ball here and there, maybe, but it was all rare and a little bit uncommon. And there's just a couple of people that are anecdotes, but we can't be sure that this is what actually happened to them. Renee France, 49, a physical therapist in Seattle, developed Bell's palsy, a form of facial paralysis, usually temporary and a dramatic rash. But Dr. France said doctors were dismissive of any connection to the COVID vaccine. The rash, a bout of shingles, debilitated her for 3 weeks. So Dr. France reported it to federal databases twice. And guess what? I thought for sure someone would reach out, she said, but no one ever did. All right, so that happens too. And this wasn't like a little bit of a failure. They comprehensively wanted to get these shots into people and didn't want anybody asking questions and didn't want anything contributing to vaccine hesitancy. But guess what? People have figured it out all on their own. If you look at the actual vaccine uptake for boosters, the data right now, no good. If you look at Moderna's latest profit warnings, well, they just lost $1 billion and probably continue to lose money because it's a big, giant organization without a product to sell because nobody wants it anymore, right? People already figured it out on their own. Federal agencies are not. Apurva Mandavili's completely horrid reporting on this or not. People already figured it out. Now, question is, why is this article coming out, though? And my best guess is it's an election year, and finally some people in power have figured out that killing and wounding the people you want to vote for you doesn't track well. It doesn't poll real good. Maybe they figured that out. Maybe they ran a focus group like, hey, we continue to insist that you should get these shots that you've already figured out harmed your aunt and killed your uncle. And we're thinking, how do you feel about that? Oh, you don't like that? Oh, maybe we should start backtracking. Let's start trickle-truthing this because, we couldn't just come out with the truth. So we're going to trickle-truth this. We'll come out with a little bit and a little bit more. And we'll just decide how much steam can we let out of this pressure cooker so it doesn't blow. And then we'll back up and then we'll go back to our usual gaslighting and lies. Because that's what this whole thing is about. Just an absolute run of gaslighting and lies. So look, we're all the way down here and we haven't even seen anything until finally we get down to, I don't know how many paragraphs deep we are, but the CDC also links mRNA vaccines made by Pfizer BioNTech and Moderna to heart inflammation or myocarditis. Actually, it's way more than that. It sort of links it to, especially to boys and young men. Okay, Apoorva, this is your chance to say, why are we even giving these vaccines to boys and young men? Why is it still this would be a great thing. I'm not do your job for you, but you go to the CDC. Hey, Mandy, who's head of the CDC now, or Rochelle Walensky, see if you can get her on record and say, why are you still recommending that we give this shot in the Omicron era to boys and young men when it risks life-altering, permanent, no such thing as mild myocarditis? At least finally they had to drop that word. I don't see mild in here. But it's very bad. It's permanent. It's life-altering. In some cases, it leads to death or a shortened life. This is pretty bad. Why would we be doing this to young men and boys who have zero risk? Like as close to zero as you can possibly get. Not from COVID, as if it's a thing, COVID, but from the circulating strain of COVID out there, which we have right now. It's simple logic. It's simple cost benefit. It's the simplest of all possible things to rationally deduce through this whole thing. And it's a question that should be asked, but it goes unasked in this amazing took a year to write article in here. Okay, so agency scientists, quote, say here, are monitoring large databases containing medical information on millions of Americans for patterns that might suggest a hitherto unknown side effect of vaccination, said Dr. Dimitra Daskalakis, director of the CDC's National Center for Immunization and Respiratory Diseases. We toe the line by reporting the signals we think are real signals and reporting them as soon as we identify them as signals. He said the agency systems for monitoring vaccine safety are pretty close to ideal. Oh, boy. You really haven't been gaslit until Dr. Dimitri Daskalakis has thrown that sort of wiffle ball at you. Pretty close to ideal. Get the F out of here, dude. That is shameful. I shouldn't have to read that. And if I do, it should be challenged immediately. Apoorva, you could have found somebody who could have told you that our monitoring is actually very far from ideal. In fact, it is designed to be substandard. In fact, it is designed not to find signals. It's like three blind mice, encoded in a software package. It's just astonishingly bad at what it does. They have no interest in figuring out real signals because that's not the game. That's not where the incentives are. This isn't hard to understand. The incentives are all misaligned in the system. All right. Those national surveillance efforts include the Vaccine Adverse Event Reporting System, VAERS. It is the largest database, but also the least reliable. Reports of side effects can be submitted by anyone and are not vetted, so they may be subject to bias or manipulation. Oh, yeah, people just take the time to hand enter these awful, 30, 40 minutes to get through this cumbersome, poorly designed user interface disaster of a system that may just, burp on you and lose all of your inputted stuff. And throw it into that, and then nobody's ever going to call you or collate it properly. And then people are going to have to do FOIA requests to try and claw that data back out, our public data, to see if they can make sense of it. So believe me, I've been tracking this thing the whole way through. And again, want to see the propaganda here? The system contains roughly 1 million reports regarding COVID vaccination. And by the way, that would be the tip of the iceberg because not all things get reported. And the vast majority are for mild events. Okay, vast majority mild, not terms. How many were not? How many were not mild events? Was it 10, 12, 38, 422,000? It's a number, right? But at any rate, we don't have science yet here running in the New York Times because, of course, they're amazing editorial standards. Somehow that slipped past their amazing editorial standards here. The federal researchers also combed through databases that combine electronic health records and insurance claims on tens of millions of Americans. So if they had gone through those insurance claims, they could have also noted that the life insurance companies had noted 10, 12 sigma events, 1 in a billion year events for deaths happening beginning in 2021. Coincident with the vaccination policies and outreach with those programs. we would have noted that if you had just combed those insurance claims, life insurance claims in particular, you would have found something. And of course, Ed Dowd found that, and we saw the heads of these CEOs of these insurance companies coming out and saying that they had found those things, or mortuary people finding weird things. We had the blood clots. We have doctors reporting weird things. We have emergency room technicians reporting, being slammed with certain things. We have oncologists reporting complete shifts in patterns. We have emergency services people, ambulance drivers reporting vastly chaotic things. But somehow federal researchers couldn't find it after combing through big databases and all of this. But there are gaps. Some experts noted, writes Apurva, which is just code speak for really sloppy reporting. This is awful. The COVID shots administered at max vaccination sites were not recorded in insurance claims databases, for example. Oh, we were just missing some data. If we missed anything, it's because we didn't have enough prying insight into your actual lives. We couldn't have possibly deduced a problem from like call center data at ambulance companies or emergency rooms, visits by people who shouldn't be there. So this poor guy really got hit. And they did note here that the European Medicines Agency, the EMA, linked Pfizer and Moderna vaccines to facial paralysis. Oh, well, maybe you could have talked to Justin Bieber. He'll tell you all about that too. It happened. Tingling sensations and numbness. The EMA also counts tinnitus as a side effect of J&J's vaccine, although American health agencies do not. But there are more than, here's a number finally, 17,000 reports of tinnitus following COVID vaccination in VAERS. Are the two linked? It's not clear. It's not clear. Of course it's not clear, Apurva. Nobody followed up on it. Just how it is. So this is, I just wanted to get that to you there. We'll talk about that. But that's all I have here for you today out in public. I'm going to now switch over to carrying on my scouting report for my subscribers back at Peak Prosperity. So all of you who are subscribers, follow me back over to Peak Prosperity. We will continue this conversation. For everybody else, hey, see you next time. Common knowledge is here. We're finally talking about it, even though they are doing their level best to minimize, gaslight, let a little bit of steam out, and otherwise trickle-truth us as if they think we're morons, which of course they do. So with that, thanks very much. We'll see you next time. Please consider coming by Peak Prosperity if you like this kind of reporting. Well, I'm there all week long. See you next time. Bye.